Commerce and Consumer Protection will come to order. Today is May 12th, and it is at 2:18 p.m. There is a quorum present, and just to go through a few things, members, as we go through the meeting, we have a few reminders you want to work through on the online meeting process. If you want to be counted in the quorum or want to be counted for your vote, you have to have your video on. And for a voice vote, I would ask you please say A or nay, and then indicate with your thumb up for an A vote and down for a nay vote. And to limit feedback, I'd ask if you're not speaking that you mute your microphones. If you have any questions and you're on Zoom, please raise your hand. That's a little green or blue button over in the right-hand corner. And when you get done speaking or have been recognized, then please lower your hand. I will recognize the speakers in order, the people with questions or that want to make a comment in order of the way their hands went up. And finally, you should have received in your email this morning a copy of the bills, the amendments, and the people that will be testifying. And for the members of the public, all of the documentation has been posted on the committee page on the Senate website. Members, today we have one bill on the agenda, and our bill number is Senate File 3204. Senator Rosen is the author of Senate 3204, and Senator Housley, would you like to move Senate File 3204 to be recommended and passed and placed on general orders? Senator Housley?
So moved.
Thank you, Senator Housley. Senator Housley moves that Senate File 3204 be recommended to pass and placed on general orders. There is an amendment that was in the packet, and Senator Housley, would you please move the A9 amendment?
Mr. Chair, I would like to move the A9 amendment.
And Senator Housley moves the A9 amendment. Senator Rosen, would you please explain the amendment?
Thank you, Mr. Chair. Very good to see you, and thank you for allowing me this hearing on this very important issue as far as prior authorization. So Senate File 3204 is a utilization review and prior authorization of healthcare services modification. The A9 amendment, Mr. Chair and members, basically it is something that came together this morning, and I can actually say with this amendment, there is peace in the valley. And you don't get to say that very often with prior authorization. But there was, in this A9 amendment, we wanted to make sure that managed care plans and county-based purchasing plans are not, are exempt from 62M because they already meet the federal regulations under their Department of DHS contract, and the timelines are very similar to the current law on that. There was also much negotiations over the standard review determination and how that was going to be brought forward. As far as if it was electronically, it would have to be within 6 days, and on that amendment that's on line 1.11. If it was a non-electric means, it'd have to be received within 6 days, and then it would go down to, by January 1st of 2022, down to 5 business days for non-electronic. Otherwise, electronic means for standard review would all be 5 business days. And that, effective January 1st of 2022, is the only change in the date of the bill that is different from the January 1st of 2021 for the rest of the bill. So I wanted to point that out. There was also a lot of discussion about in section 17, and having the health plan companies and the claims administrators as part of that section. And I think Commerce would like to have a part of this section. This was never really discussed, and we feel like this could be something that can be worked on next year, because as I would like to stress, and I will be stressing this over and over again, this is a very tightly crafted bill with the proponents and the opponents to it. And so that is basically the A9 amendment.
Well, thank you, Senator Rosen, for that explanation. Members, any questions for Senator Rosen on the A9 amendment? Seeing none, all those in favor signify by saying aye and raising your thumb.
Aye.
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 All those opposed signify by
Aye.
saying nay. And members, the amendment passes. Senator Rosen, please present your bill as amended.
Thank you very much, Mr. Chair and members. And before I get started, this is truly a bill that I would like to thank all the past and present legislators that have worked on prior authorization.
Great. I didn't hear from you, so I didn't know.
Whoops. And, you know, Senator Franson, I can remember when she was in front of Health and Human Services Committee years ago. Many people have had their hands in this. And I would like to thank, of course, the providers and the health plans that have been working on this. And if I could, some of the supporters and people that have been very active in this is Gillette's Children's Hospital, the MGMA of Minnesota, the Academy of Pediatrics, CDI Diagnostic Imaging, Minnesota Orthopedic Society, Mankato Clinic, the Orthopedic and Fracture Clinic, Minnesota Psychiatric Society, Minnesota Academy of Family Physicians, American College of Obstetricians and Gynecologists, the Podiatrists, Children's Minnesota, MHA, MMA, and of course all the health plans. And it is, like I said, been worked on heavily for a long time. So Senate File 3204 does not eliminate prior authorization. On the contrary, this bill provides more transparency as to the criteria used for prior authorization, shortens the decision-making timelines, and ensures that patients get the treatments they need in a timely manner and reduces the administrative burdens. National estimates show that the cost of a prior auth is $63,000 per physician per year. And for Minnesota, that is over $1.3 billion spent on administrative work in prior authorization. A survey performed by Minnesota Hospital Association between 2018 and 2019 in two separate questions. The first question was the percent increase in how many prior auths did your hospital complete. For a statewide average, there was a 17% increase. For small rural hospitals, there was a 91% increase in 1 year of the number of prior auths that they completed. The second question was, how many FTEs has your hospital hired in the last years? That percent increase. For a state average, it was a 14% increase. And for small rural, it was a 25% increase in the number of new employees doing just a prior auth. So I cannot stress enough the tremendous work and the amount of work engaged between the proponents and opponents, and I'd like to sincerely thank them. I'd also like to thank, Mr. Chair, Representative Kelly Morrison for her engagement and leadership on this bipartisan bill. There were many meetings with stakeholders and Representative Morrison and myself. And because of this, we now have a bill before us that is consensus. Basically, nobody really likes it, but there is peace in the valley. So if I could go through the bill quickly and just point out some of the pieces that were either taken out or agreed upon, some of the high points of it. The original bill, section 1 was taken out at the request of the health plans, and that language only applied to HMOs, saying that coverage cannot be denied solely for not requesting a prior auth. That has been deleted. So the section 1 now in the first engrossment clarifies the jurisdiction to include other entities that may contract with a health plan to do utilization review. And this was at the request of the health plans and the chamber, and it removes any potential ERISA challenge. Sections 2 through 8 update several definitions related to utilization review organization, the URO, and the prior auth, the PA. Section 9 was a highly negotiated piece of section. It deals with a standard review determination. Current law requires a URO, a utilization review organization, to make a decision within 10 days for a standard determination and 72 hours for expedited determination. The original bill that came out the middle of February proposed one timeline for 36 hours for all determinations. The compromise is to reinstate the standard and expedited determinations separately, and to go from four days to 5 business days after receiving the request. So for non-electric prior auth, it is 6 days, and this is noted in the amendment that we just adopted, 6 days for 2021, going down to 5 business days in 2022. And that is the 1 day change that is different. And then for electronic PAs, it's 5 business days across the board. Section 10 was another area highly negotiated, expedited review determination. Current language is 72 hours to authorize an expedited adverse determination. And the compromise language is 48 hours and must include at least 1 business day after the initial request. Section 11 is failure to provide necessary information. Mostly technical changes related to providers' requirements to provide the needed information for the URO to make their determination. What has been removed is a section dealing with coverage of services included in a bundle of services, which was a health plan's request. Section 12, which deals with standard appeals, also very well negotiated. Current law requires a standard appeal to be complete within 30 days and an expedited appeal to be complete in 72 hours. The original bill, all appeals were to be completed in 72 hours. And now the agreed upon language is standard appeals be completed within 15 days. And if determination cannot be made within those 15-day period due to circumstances outside the control of the utilization review, they can take an additional 4 days to notify the enrollee, the healthcare professional, and the claims administrator if it's of its determination. And it was originally 14 days, so now it's down to 4 days. Section 13 is the written standards and retroactive denials. Subdivision says that the URO cannot retroactively revoke or change a prior authorization that they have approved unless for fraud or misinformation. Section 14 is the physician reviewer and adverse determination, another very highly negotiated piece. And this is the review by the physician with same or similar specialty. Requires the person denying a prior auth to not only be a licensed physician in Minnesota, which is current law, but that the physician have the same or similar specialty as the provider that typically treats the condition. And there's new language that this has been over the last week, new language that exempts the PBMs from this requirement to allow decisions to be made by licensed physicians or the pharmacist. And that was agreed upon by all parties. Section 15 is the prior auth criteria posted on a website, and it requires a URO to submit the evidence-based clinical criteria to use to make a prior auth determination to the health plan, and the health plans must post them on a public website. Section 16 is the 45-day notice of all new prior authorizations and requires the URO to provide advance notice of any changes to a prior auth requirements and that they be posted on the public website. Also requires the URO to provide written notice to all in-network providers prior to the change. The original bill required a 60-day notice. The proposed was a 45-day notice to align with other notices requirements in law. And this also clarifies that the written notice may be in electronic form. Sections 20 and 21 of the original bill have been removed and would have allowed providers to file complaints with the Department of Commerce. Current law only allows patients to file complaints, which would have issued a fiscal note. So, and then we also removed a section which would have provided teeth to the law by requiring a URO that fails to comply with these requirements to deem the service approved. That has been taken out. Section 17 is the continuity of care. Subdivision 1 applies to a patient that has an approved prior auth and changes health plans. The bill requires the new plan to cover the service for at least 60 days to allow the patient the time to meet with their practitioner and to determine the next steps. The compromise subdivision 2 says that if health plan changes coverage terms or the clinical criteria for PA during the, subdivision 2 says that if a health plan changes coverage terms or the clinical criteria for a prior auth during the enrollee's contract year, the plan must continue to cover the drug or procedure for which they approved the prior auth. What was deleted was a subdivision that addressed that if the enrollees stay with the same health plan but has a new product, it would have required the health plan to continue to comply with the prior auth that the health plan approved. And that we could not come to an agreement with, Mr. Chair and members. Language was also added to allow changes if a drug has been deemed unsafe by the FDA when a new generic comes on the market, or if a change is related to patient harm. Section 18 is the annual posting on a website, which requires health plans to post all their public websites the annual number of prior auths that were authorized and the number that were denied. Removes requiring the report to be broken out by physician specialty to simplify the reporting, and includes additional reporting language related to the use of electronic PA and the reason services are denied. And with that, Mr. Chair, I just wanted to check if we had another section in there. Yes, the compliance report, section 19 on drug prior authorizations, which is was agreed upon by MDH, felt that this is information that's acquired by the health plans and they could do that at no cost, basically a study. What was removed was changes to the MA or Minnesota Care, which would have issued a fiscal note. Also, we also removed the development of the electronic PA, which would create a fiscal note. And the severability section was deleted at the request of the health plans and the chamber. Article 2 then is all conforming changes caused by standardizing the language from certification to authorization. So with that, Mr. Chair and members, that is the Senate File 3204, and I'm very pleased with this bill.
Mr. Chair, you're on mute.
Thank you, Senator Rosen, for the presentation of Senate File 3204. Members, are there any questions for Senator Rosen? Any questions? Seeing none, we'll go on to the testifiers. Mr. Dave Renner, if you would like to come forward, or
Mr. Chairman and members.
Welcome to the committee, Dave. Please
thank you very much.
Your name and who you represent.
My name is Dave Renner, representing the Minnesota Medical Association. Thank you for the chance to say a few words. And I first want to say thank you to Senator Rosen for the work she has done, because there has been a significant amount of compromise on both sides on this bill. None of some parts that we haven't liked, but we, as she said at the end, this is still a good package bill that we still strongly support. This bill tries to address problems that you have all heard from your constituents. It's the hassles, the interferences, the delays in care caused by prior authorization and other utilization review that kind of gets in the way of patient care. Prior authorization was started as a tool that was really to address kind of high cost services and experimental services, unique types of services. As Senator Rosen pointed out, in the Hospital Association survey, the number of prior auths has increased significantly just in the last few years. But yet what we see is the number of approvals remains the same. So we're not denying more care, but it's being used for services that are now kind of routine, including we're hearing quite often for generic drugs and for other services that it just doesn't make a lot of sense. So what this bill tries to do is to put some rationality to it, tries to remove some of those interferences as much as we can, and then also to try to address some transparency to the criteria that goes forward. As I say, from our members, from physicians, when we hear a lot about physician burnout and dissatisfaction, when we ask them, the number one reason we hear is things like prior authorization and interferences in patient care. But more importantly, we are hearing from patients, and that's why Senator Rosen talked about the 21 different groups that have supported this. A number of them are patient groups that have members who are not able to get the services they need in a timely manner. So we really appreciate what this bill tries to do. There have been compromises on all sides. There are pieces that we thought were very important that have been taken out of the bill. I know from the health plan's point of view, there's pieces that they don't like that are still in the bill. But again, to Senator Rosen's credit, I think we have a bill that at least nobody is strongly opposing, everybody seems to be comfortable with, and we still think has a good package of reforms that will move us forward. With that, Mr. Chair and members, I'd be happy to answer any questions. And again, I just want to say thank you and encourage you all to vote yes.
Thank you, Mr. Renner. And I see that Senator Housley, do you have a question or comment? Senator Housley, you have your hand up. Well, thank you, Mr. Renner. Certainly appreciate your testimony. If we could have Mr. Andreessen, if you would like to testify next.
Thank you, Mr. Chair, members of the committee. Thank you for the opportunity to testify. My name is Dan Andreessen with the Minnesota Council of Health Plans, the trade association representing Minnesota's 7 nonprofit health plans. We appreciate all the work that's been done on this bill in a short amount of time. The council and its members have been meeting regularly with Senator Rosen, Representative Morrison, and proponents since the bill was introduced in mid-February to discuss language that improves but also maintains an appropriate prior authorization process. As health plans, our primary focus is to improve the process for our patients and the enrollees we cover. We are grateful for the changes that have been made to the bill and many of the changes that are within the A9 amendment. We commend Senator Rosen for efforts to bring all the parties together, for listening to our concerns, and working on this Friday product. With that, I'll just stand for questions. Thank you.
Well, thank you, Mr. Andreessen. We certainly appreciate it. Senator Housley, I see you have your hands up. You have a question, Senator Housley? Senator Hayden.
Well, thank you, Mr. Chair. I just wanted to commend Senator Rosen. I know this has kind of been a tough bill and a long time coming. I know some of the folks that were a little concerned when we started HHS from the counties and others were working with you, and they seem comfortable. And I think that as the former chair of this committee would say, we got to get half a loaf sometimes, and looks like we got a little more than that, and we'll keep working to see how this works. And I just wanted to say thank you for the bill.
Thank you. Mr.
Thank
Chair.
you, Senator Hayden. Senator Rosen.
Thank you, Mr. Chair. And I would like to address Senator Hayden's concern in HHS, and that was on the county-based purchasing piece, which we did make sure that we did take care of that. And it is exempt from 62M, which makes them, you know, they follow under the DHS guidelines. So we did take care of that. And thank you to the HHS committee members for passing out a bill that did have a few issues that were still to be worked on, but we got it done.
Thank you, Senator Rosen. Senator Housley.
Thank you, Mr. Chair and Senator Rosen. I was just wondering, was there any discussion in all the negotiations? And thank you so much for getting this done. I know it took a long time and you put a ton of work into it. I'm just wondering, was there any talks about the effective date, and can the stakeholders, is it too aggressive, or are they okay with it, or where was that in the talks? Thanks.
Senator Rosen.
Thank you, Mr. Chair, and thank you, Senator Housley. Oh, yes, the effective dates were very much in the negotiation, and the effective dates are consistent throughout January 1st of 2021 until you get to the standard review for the non-electronic determination, which will come into effect. It starts off at 6 days in January 1st of 2021 and goes to 5 days. That will be the same as electronic standard review in 2022. So that's the only difference in the deadline or the time frame. But yeah, of course, there was a lot of negotiations on the time frame of this, and this is what they came up with. And they seem to be very pleased with it.
Follow up, Senator Housley.
Thank you, Mr. Chair. That was answered, and thank you, Senator Rosen.
Any other members with questions for Senator Rosen or for the testifiers? Any other discussion? Seeing none, Senator Housley renews her motion that Senate File 3204 be recommended to pass as amended and placed on general orders. Senator Housley.
So moved.
Thank you, Senator Housley. All those in favor signify by saying aye.
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 Opposed, nay. The motion prevails. Members, this concludes the business in front of the Senate Commerce and Consumer Protection Committee. I believe this will probably very likely be our last committee meeting for this year. So I just want to thank the entire committee. We've had a good year and thank you for working with us, and we worked together and we got some things done. And so I just want to thank you for that. And with that said, there's no more business to come before the committee today, so we are adjourned.
Thank you very much, Mr. Chair. Thank you, members.